Abeywardena, over to you on the topic of all palm phenolics as a bioactive ingredient in promoting cardiovascular health. Thank you.
Thank you, Madam Chairman, for the kind introduction. Ladies and gentlemen, good afternoon to you. Firstly, I'll wish to extend my gratitude to MPOC for the invitation to speak and present some of the data on palm phenolics. Already there has been 3 presentations been introduced, and you are quite familiar with the background of it, but there are people who missed that session. I will have a couple of simple slides to explain that. So my talk going to focus on the possibility of using oil palm phenolics as a cardioprotective ingredient in a diet or human. So firstly, why dietary antioxidants? We know from epidemiological data as well as more recent trials that consumption of foods rich in antioxidants are beneficial against several chronic disease states. And they include cardiovascular disease, cancer, arthritis, as well as cognitive impairment. And antioxidants prevent free radical generation. And free radicals, as we know, as we have heard, they are generated both in the body, internally, as well as from external sources. So free radicals are not totally bad. We need free radicals for our normal homeostasis and the ward of pathogens and disease states. So when issue comes, when we have an imbalance of how much is being produced and against how much is unwanted to do more than towards a pathological state. If you look at the cardiovascular disease, which is the focus of this presentation, the current theory is oxidative stress plays a leading role in vascular inflammation. That is what we call the endothelium, that is the innermost layer of blood vessels, and increased free radical, which can be accumulating due to different cardiovascular risk factors. It could be your lipid metabolism, increase in blood pressure, diabetes, as well as smoking. They can contribute an increase in oxidative status in the body, which lead to a changes in the blood vessel behavior, leading to abnormalities in the vascular event, include vasoconstriction, thrombosis, and so forth. And this is the progression of atherosclerosis, if you like. If you look at it, the first primary intervention point, or not intervention, primary damage occurs at the innermost layer. This is only a single cell layer, the endothelium, and then as the progression of disease occurs, once the foam cells comes in, and then there is a plaque formation, and in the end, this fibrous cap gets thinner, and it becomes fractured, and there is a thrombotic attack occurs. The most common for a sudden cardiac attack is these unstable plaques. Plaque stability is the key determinant. So if most people would have plaques, the atherogenesis starts from a younger age anyway. And if you can have plaques, but if we want to make it stable, that is most of these current drug therapies like the statins and blood pressure lowering ACE inhibitors, more than their primary course of action, that is to lowering of cholesterol or lowering of blood pressure, they have multiple actions, one of the major one being stabilizing a plaque. So plaque stability is important. What I want to highlight is that most of these processes involve different cytokine, different mechanisms, and as it happens, polyphenols seems to have some effect in that whole multitude cascade of events. And if you look at the cardiovascular health data, there is good evidence now. These are good, well-conducted studies. So collectively, you can say polyphenols from red wine, grape, and green tea, they promote vascular health. So that is the blood vessel function. They stimulate the formation of nitric oxide, which is a gas that promote opening of blood vessels. That's the vasorelaxation. And then inhibit platelet activation. They improve vascular smooth muscle cell function by reducing vascular oxidative stress and reduce the expression of antioxidant and pro-antioxidant enzymes. And also, polyphenol treatments are associated with a reduced expression of this enzyme called NADPH oxidase. And it is very important because this is a hotly pursued target currently by the pharmaceutical industry. This actually produces free radicals within the blood vessel itself. So vascular, that's why I am highlighting the vascular source of superoxide anion. And that works through a reduction in the, when you have blood pressure, this angiotensin system, A1, A2 system, actually directly stimulate vascular NADPH oxidase. And you can see, and it produces this superoxide radical, and with the multitude of actions happening in the hypertensive vascular damage, vascular remodeling, and so forth. This is very quietly linked. So if you were to prevent this formation, one could, hopefully, that's the pharmaceutical industry angle, you might be able to ameliorate some of those actions. So from the endothelium viewpoint, the endothelial cells and the physiological activators are there. Those are normally what the body sees, ADP, bradykinin, thrombin, and even shear stress promotes nitric oxide and endothelium relaxation and the beneficial actions. And there is a good body of evidence, which is the center of this talk too, that nutritionally derived activators, those are the polyphenols like red wine, berry, green tea, and so forth. And the platelets have a deactivating action through this nitric oxide promotion. And if you look at the reported properties of polyphenol within the cardiovascular system, as you can see, oxidative stress plays a role, reduction in oxidative species, and increased mitochondrial activity. Then there is this atherosclerosis component, prevent oxidation of LDL, increase LDL, HDL, and so forth. And there is evidence on MMP, that is the matrix metalloproteinases. Those are enzymes that actually involve in plaque stability. So there is some emerging evidence that polyphenol consumption may actually promote stability of a plaque, but there is more work to be done. And cardiac hypertrophy is influenced, hypertension, blood pressure, and its related actions mediated through those different mechanisms within that box. So what's the potential of polyphenols as a bioactive? Polyphenols, they are nothing new. We have been using them for centuries because both the Chinese pharmacopoeia and Ayurvedic Indian pharmacopoeia describes the use of plant products, bit of this, nuts, seeds, and barks for treatments of all kinds of illnesses. So most of these compounds that originated from the plant kingdom are a good source of polyphenols in addition to certain alkaloids and so forth. So the pharmaceutical industry over the last, even a century have been using these, what I call the raiding the forest, and looking for certain templates where they base their new drug development strategy. So aspirin, as you know, came from the bark of cinchona tree. There opium and digitalis glycoside from foxglove. There are 25% of the modern pharmaceutical industry are of plant origin. And more recent epidemiological observation from the French paradox showed the evidence of polyphenols. Then supporting evidence came from cancer and CVD in the late 90s, and human studies are ongoing. However, still we lack large-scale clinical trials for the benefits of polyphenols. And this is a common thing when you're reading. It's not because they are not true, but they are costly to do, and not many pharmaceutical firms will be willing to fund those large clinical trials. And food industry doesn't want to dish out money either. So the same issue has happened to fish oil. When we were showing that benefits of fish oil, a lot of people didn't want to believe that. Clinicians didn't believe it. And the food industry didn't want to fund clinical trials until maybe 10, 15 years ago that multi-center trials started. Now fish oil probably is now considered as one of the under the PBS scheme that the doctors can write scripts to reduce your triglyceride. I'm sure polyphenols will go through with the emerging body of evidence for that level. But there are a lot of products being marketed, some without any substantiation, and they command a lot of money, and the production capacity of these compounds like red wine polyphenols, grape seed extracts, they are somewhat limited. So the cost is supply and demand concept here. So is there a novel source? And Dr. Ravi, as you know, the first speaker, she mentioned all the avenues that we have to generate. There is a good source that one could extract polyphenols if can establish the profile of science. So as you have heard the last 2 days, palm oil industry is a global supplier of natural antioxidants and bioactives. So the established ones in the current marketplace from palm-derived bioactives include vitamin E, carotenes, both alpha and beta there, and tocotrienols, well covered yesterday and this morning. And in addition, as Ravi mentioned, recently MPOB researchers identified this water-soluble polyphenol compound, and then the question is how to establish its functional properties, different scientific substantiation. So if you look at what are the other similar things, olive oil industry has extracted polyphenols and similar compounds from the oil mill wastewater. And there are olive leaf extracts being marketed presently as polyphenol-rich components. And Origio olive oil is a secondary waste product, but it's not a phenolics, it's a triterpenoid compounds in there. And we published very early, about 10 years ago, that oil palm frond has vascular relaxation activity. And then the MPOB colleagues came up with this novel polyphenol fraction extracted from the water that post recovery of oil. So this is the slide that you've seen this before. There is phenolics component in there as well as non-phenolic constituents within that. So how do we establish bioactivity of some unknown compound? Firstly, one has to identify the target mechanisms, because with the understanding that we are not dealing with drugs here. These are natural compounds, so your pharmacological efficacy not going to be the same. A very good example is cholesterol lowering actions of HMG-CoA reductase. And it's very difficult to shift HMG-CoA reductase with a natural compound. There are no good evidence. There are 1 or 2 papers here and there saying rice bran or even but HMG-CoA reductase is very difficult to inhibit by a natural compound. That's why the food industry went to regulate cholesterol by a different mechanism by producing sterol and plant stanols. In that case, the mechanism is actual binding of cholesterol. So it's sequestering cholesterol in the gut, but not talking about inhibiting enzyme synthesis, because they are not of the same pharmacological efficacy. So if you trying to establish, show a positive effect, we have to be careful in selecting the proper mechanism. If not, it could be a very big ask for a natural compound compared to a purified and custom designed rational drug design approach. So we identify the certain target mechanisms, knowing its benefits, basically doing a SWOT analysis, if you like, strength, weaknesses, and that sort of a thing, because knowing the phenolic structure, what has been reported in the literature, then we establish certain molecular, biochemical, and tissue assays. Then one has to confirm these in animal models. Firstly, usually in a drug development, is a rodent model, non-rodent versus primate, because we need the data on absorption, metabolism, bioavailability, and so forth. And this is the screening that we set up in our organization, in my lab, and you know other team members and the colleagues involved in the full project. We have vascular function studies, cardiovascular, cardiac function, blood pressure, gut health, and some inflammation. So we can, through a battery of screening tests, to see which ones perform well. So for those who are not familiar with the technique, I'm going to go quickly. This is the vascular preparation. That is, if you want to see a vascular relaxation property of an unknown compound, you can get a piece of blood vessel, usually from rodents, could be rabbit or even beef or coronary arteries. You cut a small piece of blood vessels and you put it in the organ bath. Then you can add your compound and see whether it relaxes or contracts. So this is we use the aorta, which is the large conductant vessels from the heart. And we also use the mesenteric blood vessels, that is the blood supply that connects to the gut. The relevance here is these are much smaller vessels. These are the ones that control peripheral vascular resistance. That means the blood pressure control, this is basically a pumping mechanism, one could say, but this is more intimately linked to a blood pressure development, because what you're talking about is a hairline cell, very fine vessels. And by closure of them, then the resistance goes up and the pressure try to correct and the blood pressure goes up. So you can develop, you can pre-contract these vessels and add a pharmacological agent to show that is the tissue viable. Then you can add your text extract to see whether it causes relaxation, and then you can, from that. This is another whole animal model of cardiac arrhythmia and sudden cardiac death. This is the model, although this is done in rodents, because not many human volunteers we can find to undergo cardiac surgery in the lab. So this model actually been used maybe by us about 25 years ago to first demonstrate the antiarrhythmic actions of fish oil. So all that work relating to sudden death prevention of fish oil came from our group on the animal data. So this model has been validated. The rat, we did on the monkeys. Then it went to dogs by Alex Leaf in Boston. Then it went to humans. So it has a full scale of things. So this is a very robust and easy model, because you can subject the animals to dietary manipulations and do all sorts of things. So what we do here is we input a ligature in this left ascending coronary artery, try to occlude about 40 to 50%, and then once you tie it, the blood flow stops there. So that means you basically induce a heart attack. And if a rat being fed a bad diet, they quickly develop, the normal rhythm goes into a what I call an abnormal rhythm, and the rate goes very high. That calls a ventricular tachycardia. And in some animals, it develops into a fibrillation. That means the heart stops pumping. So that's the death. So this slide you saw before, in the earlier studies, we saw, just to quickly go through, OPP, when you add into that isolated tissue preparation, cause a dose-dependent relaxation. When you feed, however, when we feed that into a hypertensive model, called a spontaneously hypertensive animals, we did not see any reduction. In contrast, if you take away the nitric oxide pathway in an animal by giving an inhibitor of nitric oxide, then OPP was responsive, and it actually reduced the blood pressure. The first line is the nitric oxide present, and the animals develop blood pressure, because you're taking away that positive stimulus, then blood pressure comes down. In the SHR, the primary mechanism for hypertension in SHR is angiotensin II derived mechanism. It is not nitric oxide. So you can now, already it's giving us some evidence with regard to which pathway that we should be directing this one. And if you take those nitric oxide deficient animals and do that heart attack experiment, you can see in the absence of nitric oxide, which is the L name, is an inhibitor of nitric oxide, they are very vulnerable to ventricular tachycardia and ventricular fibrillation. And if you have OPP in the diet, in addition to L name, and it has a protection. So it's very likely OPP is a source of nitric oxide. It tends to restore the formation of nitrics in the sense. So we took that first phase of cardiac arrhythmias to a second stage. The first one was normal animals, normal diet, and we thought, okay, we put the bar up a little bit higher. That means we give the animals a pro-arrhythmic diet. That means those animals with the lard, they tend to die from our previous experience in 20 years of work with lipid and so forth. So we fed a pro-arrhythmic diet. We put OPP at 1500 gallic acid in drinking water, and we put another provenol is a red wine extract compound commercially available, and we did fish oil and we looked at that. So you can see the ventricular tachycardia wasn't influenced at all much, but when VF incidence, there's a protection in the OPP group and fish oil, and in the ventricular fibrillation duration was significantly influenced by both OPP and fish oil, and total mortality is also reduced in the presence of not as good as fish oil, but it's also a change. The other compound wasn't effective. So OPP, even against a pro-arrhythmic diet, found to be capable of affording a protection in there. Then from Ravi's lab, she fractionated the native OP preparation and provided us with a small few grams of fractions. And we were looking at, can we purify this and bring up a more purified fraction? This is the rationale for that. And we saw, if you do vascular relaxation, we saw 2 of the fractions causes good relaxation, but the fraction 2, 3, and 4 did not. And these results were mimicked in that mesenteric blood preparation. So there's both fraction 1 and 2 has to be, appears to be more effective than the other 2. So we wanted to check these in a blood pressure model. But the problem is there are only a few milligrams available. So you can't do a dietary feeding study. So because of that, we came up with an acute blood pressure model that is to monitor blood pressure within a 48 hours period of a spontaneously hypertensive rat. What we do is we quickly establish the blood pressure. Single dose is observed, put in the back of the tongue of an animal, and then we record the time as 0. Then we'll take readings at every 3 hours, 6 hours, 9, 24, and 48. So the experiment is over 48 hours. Then we return the colony, and then we repeat the procedure again. So this is a very valuable tool when the compounds are of supply is an issue. So firstly, we looked at chlorogenic acid. If you don't know chlorogenic acid, this is the active compound of coffee beans. If you have heard, green coffee is promoting vascular relaxation. This is a purified extract of chlorogenic acid. The first is the control. This is the saline in red. Nalopril is an ACE inhibitor. You can see nalopril when you give. So there is a peak. It peaks about 9 hours time window and returns to normal. Chlorogenic acid has a strong vasodilatory action, comes down and returns, and it is dose dependent. Although, and so we knew our model is working. So because we shown it with positive control, and we shown it with a purified polyphenol fraction that has been shown to cause blood pressure reduction. These are those 2 fractions. If you do the same thing with those OPP fractions, you see it follows the same route as the nalopril. It goes down. Nalopril actions coming out within a day, but OPP action seems to last a little longer. So we have evidence in another model. This change in blood pressure, that is the same experiment. We get about 24 to 28 milligram of reduction post oral administration of drug. Then how this rate against other polyphenols? And if you look at the literature, very recent data and ranges, we are within the right ballpark. These are around 20. The cocoa powder is, at a higher dose, 300, which is ours. There's the highest, about 50. Then 34 to 58, 40, and OPP, similar dosage, that is 250 milligrams per kilogram. They go up to 300 to 600 to 200. Within that, they have to have similar actions. So I'm going to go quickly. In addition to those phenolics, this preparation has carbohydrate as well. So I don't have the time to cover these, but because of these carbohydrates, OPP may be used by the bugs in the gut too. So the gut health action is another interest of ours, which we know are going to do that. So then we ask, okay, now we know it has non-phenolic constituents. So why, if we were to remove the 2 components apart, are we going to get 2 different bioactives, one for cardiovascular, one for gut actions? So we did a simple ethanolic precipitation, thanks to Prof. Ra's lab from Sam sent me the first phase of, and Ravi. So we modified it slightly. We did 2 different extraction at 2 different strengths. One is with a 50%, the other one is 100% ethanol. And this is the native OPP we started with. And if you give that 50 microliters, that delivers about 538 gallic acid equivalent, that's the yellow figure. And in the precipitate, same volume now has only about 28. And the most of the gallic acid is in this fraction, and it is 350, where it is now giving more or less the same reduction in blood pressure as that native preparation. And same is here, except this one carries a bit more activity in the precipitate. So how do these rate in the in vivo? So if we were to inject those compounds, we see a powerful vasodilatation in the animal itself. So this is the precipitate. So you can see the reduction is trivial, not much. And when you give that in the supernatant fraction, you get a significant reduction in blood pressure, and it sustains. It hasn't even reached normalcy at this stage. See, it's still lasting. So it tells me that we have basically enriched this fraction with that bioactive component, which is selective to the vascular system. So this is probably, you can even think of a tablet when you get a chest pain, like a nitroglycerin tablet. This preparation is water soluble. And if you were to make something like that to get, in the case of nitroglycerin, what this does is it opens up your coronary vessels. And we have something with a very strong vasodilatory action. So in summary, ladies and gentlemen, plant polyphenols possess a range of benefits beyond their antioxidant action. OPP induces vascular relaxation and lowers blood pressure with nitric oxide mediate reactions. And it has protection against cardiac rhythm disorders. And it has a lot of potential for developing dietary strategies to promote cardiovascular health. I've got 2 minutes left. I'm going to try this. So if you look at the bigger picture, now we have a reasonable body of evidence to say that this could be used as a bioactive ingredient. So if you look at where we're going to target this, we picked up this mechanism because of endothelium as a target. If you look at the development of heart disease, particularly relevant to Southeast Asia and in this developing world, because there is I strongly believe and we have evidence now, the adverse matrix interaction. That is, if you take one component of the diet, it gives you something, like take fat for instance. Fat raises cholesterol, but that response may not be same with a good carbohydrate versus a bad carbohydrate. So because we don't simply eat fat alone or carbohydrate alone, so there is an interaction goes on. So my hypothesis was that adverse interactions cause endothelial dysfunction, and then other cardiovascular risk factors can come in to say blood pressure, diabetes, and so forth. And we may be able to protect with bioactives. And until now, we didn't have sufficient source of bioactive to even dream about this. Because the costs are expensive, they are not of the volumes that you could extract. Whereas here, we are talking about over 40 million metric tons has been going down the drain. So I'm sure the cost-benefit analysis of the whole equation is in the positive. So that these are the different mechanisms. I'm not going to spend too much on that. So if you think about the strategies for correction of vascular disease, there's a one angle for carbohydrates. This is the oils and fats. And then there is a bioactive. Actually, my organization, CSIRO, is prominent in the carbohydrate field. We have high amylose rice. Barley Max is a product already on the shelf, and rice, and also. So there's a carbohydrate arm going on. And also the oils and fats, we can change the benefits or risks of oils and fat by certain modifications. And the bioactives, fish oil would, I park fish oil in this category, and also polyphenol. So if you have a polyphenol, and you can think of incorporating it into diets, or even to flour, where people go and make their bread or so forth, and get a effect. So I'm going to show you one slide, which to proof of concept. This is one of our recent experiments. This is when you feed, there are too many things in here, but what we done is we taken a dietary oil. In this case is high oleic sunflower oil, which is 84% monounsaturated. And if you give carbohydrate to this simple carbohydrate by fructose, the blood pressure goes up, which is very surprising. I didn't expect that. And if you do the same to a saturated fat, this is milk fat in this case, there was no change. But what we found was if you have OPP in the diet, at a higher dose in this case, 75 GAE, and in the case that blood pressure got normalized. And same thing in this milk fat group. And higher doses, you can see there was a reduction in there. So this, when you have fructose in the diet, it went up. With OPP, we can bring it down. And that's basically proof of concept, and we're going to expand on these to say whether we may be able to deliver its benefits by a dietary means. And I'll arrest my talk. Thank you.